Hello, everyone. It is now 7 o'clock and time for our talk. My name is Dr. Aisha Rush, and I am an OBGYN. I was approached by Naked Body and Skincare to do this talk on vaginal health, and I think it's very important that we learn as women about our vaginas and our vaginal health. I'm also here to kind of answer questions that people may have about things to do, not to do. The other thing is I also too am on Instagram, and I do educational videos about some of these things and some of the topics that we'll also be covering here. My Instagram handle is Dr. Aisha Rush. That's AISHARUSH, Dr. DR in front of that. So I decided to go into women's health for many reasons. I started back when I worked for Planned Parenthood so many years ago. I think I had one child then, and I now have 7, and that child is now 22 years old and in grad school. But I realized how dynamic people or women are, and I realized that we wear so many different hats. I myself wear a lot of hats. Outside of being an OBGYN, I also participate in addiction medicine and work for a company called Monument. So there are some things on my site that you'll also see about Monument and what I do there, and also how that alcohol, that's what we do there, affects your sex life sometimes. There is a video on that already on my site. But I like the fact that women wear so many different hats. We're moms, we're wives, we're employees, we're CEOs, we're doctors, we're lawyers, and all of that mixed. We're sisters, we're daughters. So with all of the roles we play, we often do it well. But the one thing that we sometimes don't do is take care of ourselves. But knowing how to take care of yourself is very important. So looking at vaginal health, I have a video where I say a vagina is a vagina. And I will still say a vagina is a vagina. It is not meant to smell like roses. If God wanted the vagina to smell like a rose, he would have made it a flower. But he didn't. So with that being said, it is very important that women know that the vagina has a normal, natural sort of milieu. It has its normal, natural bacteria that are there. And its pH balance, all of that. Those bacteria, which are called lactobacilli, create and help maintain the vaginal pH at a level that is normal for the vagina. So with that being said, then how does that pH get thrown off? It can get thrown off in many ways. Diet can be one of them. Hydration can be another one. Having intercourse can be another one. And using things like even tampons, which is why some women go to organic rather than using synthetic type of materials in their tampons because of throwing off that pH for however it does it. Douching is another thing that does that. And there can be anything that you put into the vagina that can just kind of throw that pH off that we want to try to help maintain. So, for vertical. Okay, I gotcha. I saw the vertical thing. Let's do that. Let's turn the phone vertical. So everybody's not crooking their head to the side. Hold on one second. All right, now let's see if I can get this to do that. Well, I can't. So not with my stand. So we'll just do this. So thank you guys for letting me know that. So with the pH that we're trying to maintain with the vagina, we want to be careful about the things that we use on the vagina. So you want to be careful about the different scents, lotions, all of that. You don't need any of that stuff there. You really don't. Really, the vagina is going to maintain its own vaginal pH, and it really has the ability to get that vaginal pH back to where it should be when it's a bit off normally. Sometimes that doesn't always happen normally, and when it doesn't happen normally, then that of course means that we may need to help it out. And that in and of itself can lead to things like infections, and or things, just like odor in general, where the bacteria is off in the vagina and it's not where it should be. But all of the douching, the scented lotions, the powders, that's not necessary. And sometimes people say to not even wash with certain soaps, just simply because if they're not hypoallergenic, they can also change that pH and make it off as well. So when the pH is off, what does that lead to? That can lead to things, thank you, that can lead to things like yeast infections. It can lead to things like bacterial infections. And if in fact those things occur, can they go away on their own? Sometimes, but not all the time. So when that all the time when that all the time doesn't happen, right? We need to figure out how to make that better. So with yeast infections, of course, I always say consult with your OBGYN first, just simply because what may seem like a yeast infection may not necessarily be a yeast infection. It could be something completely different. And so we want to make sure that, when you're getting over the counter things, that you're actually treating, what you think what it really is. There are some women who have yeast infections and have had them so often enough to know what it's like and what it looks like for them. And so getting something over the counter for them is probably a reasonable idea. For women who haven't experienced certain symptoms before and something seems a little bit off, I usually recommend to them to go and see their OBGYN first, because it could be an STD. And it could be bacterial vaginitis. So what is bacterial vaginitis? Bacterial vaginitis is where there is one particular bacteria that overgrows in the vagina. So again, that vagina does have bacteria in it already, but that's lactobacilli. That's the good bacteria. Sometimes some of the bad bacteria can overgrow. It's not to say that it's not there already in smaller amounts, but when they're given the opportunity to overgrow is when we have a problem. So that typically will cause sort of a grayish so I will answer that question in just a second. Somebody asked about probiotics, and so I'm going to I'll talk about that in just a minute. But that grayish colored discharge that's had that fishy odor, that's usually BV, or that's short for bacterial vaginitis or vaginosis, whichever people want to call it. So usually that does not have anything over the counter that anybody can take. That usually requires a prescription from a physician, essentially. And so that is something that you definitely want to see your doctor about, because it usually requires a medication called metronidazole. There are other medications that people are treating BV with, but usually the main go-to for most of us is metronidazole, but again, it's prescribed. So someone asked about probiotics. So probiotics, yes, of course, it's going to be helpful for the gut, but it's also going to be helpful for the vagina. There are some probiotics that do place that bacteria back to the level that it should be, or helps it to maintain that. There are some patients that I will sometimes recommend probiotics if we've been really struggling with trying to maintain their vaginal pH and they're having recurrent, consistent infections. And so for those patients, we will have likely had to go through a significant regimen of different things that we've tried to do that have not worked. And so then, not to say this is my last go-to, but it's something that I end up adding to their regimen of things that we need to do. There are some women who have had recurrent infections that use things like boric acid. And they get that, over the counter or through Amazon. And I think that's reasonable to do only unless you know what you're doing. If you don't quite know what you're doing and how to use that medication, I usually recommend for people to talk to their doctor first. Some doctors do dabble in things like boric acid and different things like that. I know I am one of them. I was actually taught that at Planned Parenthood by one of I think nurse practitioners, and they were amazing. They were really good at fighting off these, crazy infections, BV, yeast, the recurrent ones. Now, going back to yeast, what some people don't realize is when they have a recurrent yeast infections, these may very well be infections with yeast that are called atypical yeast. What do I mean by that? These are not the common yeast species that reside in the vagina that myconazole or some of the over-the-counter medications are going to take care of. These are yeast entities that are not typically killed by those. And so some women just can't figure it out. And they're just like, I don't understand why I cannot get rid of this yeast infection. So then that is when, again, the OBGYN comes in, because there are particular medications that kill off particular yeast. But the other thing that I often will do with patients with recurrent yeast infections is actually send a swab to the lab to see if I can figure out what type of yeast it is. Then I can be more specific about the medication that I am going to give them, and this will be helpful. Now, there are some women who, develop infections where we have to do a regimen of them taking medications, 3 times a week, every week. But those are special cases. But again, talking about the normal vagina, at the end of the day, it doesn't really require a lot to do to it. It really just require, just a little bit of water, hypoallergenic soap if you have to use soap. There are some people, like I said, that say don't use soap, but then there are some of us that are just like, oh no, that's how I was raised. There has to be soap down there. And if that's the case, that's fine. Another product that I do like, and I on my Instagram page, my video, there's one, I have a little towel wrapped around my head, cute little video, where it goes through the products that I've researched that I think are great. And of course, Naked Body and Skincare, they have their line of products too that you all can look through. And these products are natural. I try to have ladies be as natural as possible because natural is good. Everything that we pretty much have had years and years ago was from the earth. And most of the medications that we have nowadays is really just a synthetic form of something that came from the earth anyway. So whenever we can be natural with a vagina, that's the best thing to do. So the one thing is any of the washes, anything that says it's going to have that pH balance or give you that, these are things that you definitely want to make sure, that you look into. If you're a more natural person, trying to do things like your natural cotton tampons, and be careful about those. The natural cotton tampons and pads, they may not necessarily be fully 100% cotton. There could be a cotton core or cotton outside. You just have to make sure you double check those things. So I've been talking now for about 15 minutes or so. So I know that there was a question about probiotics. Are there any questions on the floor for now about any of the things that I've spoken about so far? So the question says that tampons are not good for you because they keep blood in there. No, actually, tampons are if they're appropriately absorbable, they're perfectly fine. Now, believe me, there are some people who don't think that tampons are good for you because of other reasons, and many of these reasons are not necessarily medical in any way. So tampons are perfectly fine. The most important thing is changing the tampon when it is appropriate, not leaving a tampon in for hours on end. Because what that can lead to when tampons are left in the vagina for too long, it can lead to something called toxic shock. It's very, very rare. Doesn't happen very much anymore. I've never seen a case of it as an OBGYN. But at the end of the day, this is just very, I was looking. I'm so sorry, guys. At the end of the day, that is not true. The tampon is there to absorb to actually absorb the blood there, and so that is what's most important. Because we have to also think about this. So how do you know a tampon is 100% cotton? So when you look at the tampon, you want to look at the description of it, and it will say tampon's core is 100% cotton. I actually just bought some, and they were by, I believe, Always. And they just came out with that brand. I used to use a few other brands, but they were from out of the country. And that was just easier for me because I knew I didn't want to just think about, I didn't even want to grapple with the idea of reading the box and all of that. But this particular one, the Always that they just came out with, says it has 100% cotton core. So that is what you want. You want the actual length of that tampon, everything to be 100% cotton. And it has to tell you that. It has to tell you that on the box. The other thing I wanted to talk about is think of this. There are some women who use menstrual cups, and that keeps the blood there too. So sorry, I'm looking at the questions and trying to keep up. So with menstrual cups, I mean, the same concept is there, and that is making sure that you are changing that cup as often as possible and not leaving it in there. So now, as far as benefits for using 100% cotton tampons, number one thing that is a benefit is that tampons that are not 100% cotton often have a core that is mixed with other more absorbent materials that may not necessarily be vaginal friendly. And so sometimes that in and of itself can kind of lead to removal of some of the good bacteria that you have in your vagina, whereas you have, something that's more natural there. It's going to do more natural things. There are a few other benefits that I can't quite remember, but I did actually put that on one of my videos as well. And I believe it's in the same video that I talk about the products to use, talking about organic cottons and washes and different things like that. But the one thing also with pads and organic cotton things is that they're not scented, because you have to understand too that when you have scented things, you're changing, again, the vaginal flora. Yeah. So we can speak a little bit more about menstrual cups. Are there any particular questions that that you all want answered about that? So what I will start with is I will say menstrual cups are it's a very personalized option. It's something that some women just choose to do just because that's just what they choose. They don't like the idea of tampons. They don't want, something. Tampons may be uncomfortable for them. And they may not necessarily, want to experience that. Now, there are some women who use menstrual cups for religious reasons. and because they use the menstrual blood for certain things. So that's the first time I had ever heard about a menstrual cup ever, is when I heard a one religious, group use the blood for particular, reasons. But some women, it's just a preference. They just prefer to not have, a tampon in there. They do want to, just kind of collect the blood and not be sitting in a pad full of blood. And so being able to just take that cup out, dump, and then put it right back in just seems easier for them. Outside of that, I don't necessarily know, unless somebody can correct me, that there's really much more of a benefit. I don't know that it decreases infection. I don't know that it decreases the likelihood of changing the vaginal flora. Now, that could be one of them, because even with cotton, you're taking away some of that bacteria. With the cup, bacteria is not going to stick to that and go with it, for the most part. So that could be one of the benefits. But other than that, I think it's more so of a personal choice, typically. So any other questions? Did I answer that question okay? So I think for the most part, I know that we've talked about some of the products to use. And like I said, you guys can also peruse, the products for naked body and skincare, because I'm sure they have a plethora of different products. I know I was just speaking, yesterday about some of the things that they had to offer, and it's pretty amazing because they're all natural, and I love that. So you can always do that. The other thing, the rule of thumb is, yes, go back to odors and what causes it. So the rule of thumb is really, if there's something that you are questioning about going into the vagina, you probably shouldn't put it there until you ask somebody, like an OBGYN. And going back to what causes vaginal odor, it's usually bacteria. That's what's going to cause your underarm odor. That's what's going to cause your foot odor. That's what's going to cause the vaginal odor. Now, of course, there's also the element of blood. It doesn't always smell the greatest. Old blood doesn't smell the greatest. So sometimes when women are on their menstrual cycles, or they're in that stage of spotting, there may be some blood that's just left over there that doesn't smell all that great. The remnants of blood can sometimes just be, just kind of not, too great of a smell. But again, whenever there's a question of vaginal odor, we want to make sure that we're not dealing with an infection like bacterial vaginitis. That's typically the one that's going to create the fishy odor. Now, we also have to consider the STDs and making sure that we're not in a situation where there's an STD that could be present. So whenever there's a concern or a question, I usually always tell women to make sure that they look to their OBGYN for help, because we want to rule out all of the bad things first and fix the things that can be easily fixed, as quickly as we can. So, but yes, usually bacteria is what causes odor, and usually that can sometimes be infection, or it can be an STD as well. Any other questions about that, about odor, or anything else that we've mentioned so far? So the question is, are there certain types of foods to eat or to avoid? So this is what I will say. I can remember a time I had a friend that potatoes was a staple in her diet because of where she was from. And she would always battle with yeast infections. And I remember her saying, I don't know how I'm going to manage this, because potato is a staple of my diet. How am I going to manage not eating as many potatoes? So sometimes, there can be things in your diet that you definitely want to sort of stay away from if you notice that the increase in these things cause problems for you. Interestingly enough, I have another friend that has issues with dairy. And dairy always leads to some type of imbalance vaginally. Why that is, I'm not quite sure for that particular patient, but that's her. There are some women when they don't drink enough water, even when they don't stay well hydrated, they have a problem with developing not only urinary tract infections, but they also have problems with developing vaginal infections at the same time. So the one thing is, rule of thumb is with any diet, you don't want to overdo anything. You always want to stay very hydrated, and you always want to have a very balanced diet with your proteins, your carbs, and your vegetables and fruits. So that's the most important thing. Anything in excess can always cause a problem. And I always tell patients that as a rule of thumb, anything in excess can cause too much of a problem. So as long as and that could be a problem, not necessarily vaginally, but otherwise. Oh, I'm not going to answer that question. I think Quadisha can probably answer that. So, needless to say, I would say when we're talking about vaginal health and we're talking about when we're talking about what things to avoid and what things to do more of, I would just say really stick to a balanced diet, because everybody's chemistry is different. Everybody's body chemistry is very different. So, but you're very welcome. Did I answer your question okay? All right. So I think we probably, if there are no other questions out there, I think we covered quite a bit of material. I'm glad I answered your question. Thank you so much for answering back. I think we covered quite a bit of material. Like I said, bottom line here is when in doubt, do without. So what I mean by that is if you don't know if this is going to, whatever product you're using is going to be good for your vagina, just ask your OBGYN. Don't do it first and then ask later, because doing it first and asking later can put us into a frenzy of things that we have to do later in order to fix it. And if we were just able to do, what we needed to do from the beginning, then we could have probably fixed it much faster. I've had so many women come into the office and they've done their own thing. They've tried to use this, they've tried to use that. And as physicians, not all of us are all into just throwing out medications. There are some natural things that we can tell patients to do. So I want you all to be comfortable enough with your physician to talk about these things, because you can go in your physician's office and say, well, I thought, I heard coconut oil helps with this. Your physician may or may not know the answer to that question, but at the same time, hopefully they would say, I don't know the answer to that question, but this is what I think. But they can at least tell you what it is that you think is going on down there, and then try to give you some different options about how to proceed, so that you're not, going down the primrose path of picking and choosing so many other things. Being allergic to sperm, I'll get to that. Yeah, so going down the primrose path of picking and choosing so many other different things to try, when really what you may have been trying to treat was not what it really was, and it was something completely different that we could have helped with and not had you go through all of the agony of the symptoms. So being allergic to your partner's sperm, I don't know that I've ever heard that. I think that there was a thing out there about that, and I know that there are sometimes some issues with fertility between, men and women and the sperm and different things like that. But being allergic to it, I'm not quite sure that I know that is actually something. I don't know that people are allergic to their partner's sperm. I would have to look that up and see if there are anecdotal things out there. But I've never talked to a patient about being allergic to sperm. Now, have I had talks with patients about issues with sperm, egg, and all of that? with infertility discussions? Yes, I have, but they're very specific to people and what it is that they're actually experiencing. So, but I would have to get back to you guys on that one. I don't think that that is a thing, though. I don't think it is. I would be very surprised. I've never had to talk to a patient about it. So, all right. Well, I know that we're at our 30 minutes almost. So, the sperm really throws off. It can. Sperm can sometimes throw off women's pH balance. Yes, it can. And the hope is that if that happens with your body's normal, you're welcome, with your body's normal, mechanisms of returning the vaginal pH back to normal, it'll do that on its own without you having to do anything extra. So, but yes, sperm can, anything you put in the vagina can throw off the pH. But again, the vagina is a very wonderful organ because it really knows most of the time what to do in so many cases. But in this particular case, in most cases, it will go and correct itself if the pH is off. And sometimes we have to help it when it's not. Now, there are over-the-counter medications that help with trying to keep the vaginal pH. There is something called Refresh. I think Naked Body and Skincare may have that formulation too, but there are things that can help keep that pH and maintain it. I usually recommend that when people always are in a position to have recurrent infections where I have to get them to try to maintain the vaginal pH to normal so that they don't constantly get infections. But yes, sperm can throw things off too. So, all right, are there any other questions, everyone? Well, it has been a nice treat to speak with all of you guys. And thank you all so much for tuning in. I really do appreciate it. Again, my name is Dr. Aisha Rush, and I'll talk about the yoni steam in just a moment. But you can see my information and all of the videos. Somebody said they have so many they can't think. Well, we have plenty of more of these to come. So you guys we have another one, I believe, on the 29th. So I think you'll always have, time to ask your questions for certain. But at the same time, you can also go to my Instagram page, Dr. Aisha Rush, DrAishaRush. And if you have specific questions, I'm happy to answer your questions there. And you can definitely, follow me there. I usually will answer a lot of these questions in videos, and I already have a few of those videos posted for those who are just, coming into the live stream. But yeah, if you go to my, like I said, Dr. Aisha Rush, you go to my page, you can send me questions there. And then you can also, just see some of the information that I posted in videos. So going back to the yoni steam, okay, yeah, I would definitely do that. So going back to the yoni steaming, I'm not a fan of steaming, and the reason why is because I have a video about that too, and the video it talks about the benefits and why would there be a benefit to it. Now, don't get me wrong. There are some people who believe in it. I think it's more relaxing and therapeutic, more than anything. But as far as there being any particular benefits, I don't know that I see any, because you have to also understand that you're trying to get steam in a very closed hole. The vagina is not an open hole like this. It collapses on itself. And that's what gives men pleasure, in terms of that, because it does collapse. And at the end of the day, that steam is not getting all the way up in there. It's just not. It's not. So, but in terms of having sex afterwards, I don't know that there is a time frame. I really don't. I don't know that there's a time frame that it's not recommended. I mean, now the people who provide that service, they may be better able to give you that answer, but I don't see that there is any particular time frame that's needed, because I don't know that there's any, particular benefit outside of therapeutic that women are receiving from that. Now, there are some, I think they do some with the herbs and different things like that. Yeah, but I don't, again, the vagina is a closed hole. It's a hole, but it's a collapsed hole. So, I think somebody said I've heard some females get pregnant from doing so. I'm not sure from doing. I don't know what that means. I don't know if that means that they do the steaming and they get pregnant after they do the vaginal steaming. Well, I mean, and if that's what that meant. So there's no scientific evidence that it helps with, fertility. Those are anecdotal things. There is no benefit that it helps with heavy blood flow. Herbal steams, same thing. Honestly, if you're going to do something herbal and they're able to be ingested, it's better for a person to potentially ingest the herbs that they're trying to get the benefits from. But that's only if those are meant to be ingested. If there are herbs that are not meant to be ingested, then do not ingest them. But if you're talking about, different herbs that can be, eaten, a lot of people even do essential oils. They put them in their water, the ones that they can, actually, that they can actually consume. So more so than anything, rather than that being on the outside of the body and in steam, it seems to me to be more beneficial to use them, in a different format, because I don't necessarily know that you're getting as much benefit from that way. But yeah, I don't know that the steaming, the yoni steaming is going to increase fertility. I don't know that it's going to decrease blood flow. There's no scientific evidence of any of that. And if people do say so, it's very anecdotal. And it's something that we simply likely have not researched because of the fact that it's anecdotal. So, I mean, there are things that can decrease blood flow, but usually it's not steaming that I'm aware of. So, okay, guys, where I am going to take off, I still have another hat to wear this evening because I still have patients to see with my Monument platform. And so it has been such a pleasure. And like I said, there are many more of these talks to come. And again, please, please, please go and check out my Instagram page, follow me there. I always have something new coming up. If it's just a wonderful saying of the day, just to get your day started, or after a crazy long day, something's there to make your day better, I have that. But also there's a lot of educational stuff there in terms of videos. And I'll be increasing my videos as we go along, as my page builds and things like that. But again, we will have another one of these sessions so I can answer all of your questions yet again. I know that there are so very many. We'll get to all of them slowly but surely. But again, you can also message me on my page as well. All right, guys, it has been great. Thank you all for having me. Thank you all for listening and joining. It's been awesome. I'll see you all soon. We'll try to do this again, I believe, on the 29th. You'll get the advertisement. All right, you all have a great evening. Thanks, guys. Bye.